Introduction to the muscular system. When most people think of muscles, they think of muscles that are visible just under the skin, particularly of the limbs. These are skeletal muscles, so named because most of them move the skeleton. But there are two additional types of muscles, the smooth muscle and the cardiac muscle. The body has over 600 muscles which contribute significantly to the body's weight. The anatomy of the muscular system. Muscle is one of the four primary tissue body types and is made up of specialized cells called fibers. The body contains three types of muscle tissue: skeletal muscle, cardiac muscle, smooth muscle. All three muscle tissues have some properties in common. They all exhibit a quality called excitability, as their plasma membranes can change their electrical state from polarized to depolarized and send an electrical wave called an action potential along the entire length of the membrane. Fascia is fibrous connective tissue that encloses muscles. There are three types of muscle tissues: skeletal, which is closely associated with the skeletal system, also known as striated muscles, and are responsible for voluntary muscle movement, such as swallowing. Smooth, mainly associated with the walls of the internal organs, also known as visceral muscles, and are responsible for involuntary muscle movement, such as breathing. Cardiac, heart muscle or myocardium. Its appearance is similar to a skeletal muscle and is responsible for the pumping of blood. It gives the heartbeat. The gluteus maximus is the largest muscle, and the heart is the hardest working muscle. Skeletal muscles. Skeletal muscles act not only to produce movement, but also to stop movement, such as resisting gravity to maintain posture. Small, constant adjustments of the skeletal muscles are needed to hold a body upright or balanced in any position. Muscles also prevent excess movement of the bones and joints, maintaining skeletal stability and preventing skeletal structure damage or deformation. Skeletal muscles are located throughout the body at the various openings of internal tracts to control the movement of various substances. These muscles allow functions such as swallowing, urination, and defecation to be under voluntary control. Skeletal muscles also protect internal organs, particularly abdominal and pelvic organs. By acting as an external barrier or shield to external trauma, and by supporting the weight of the organs. Skeletal muscles contribute to the maintenance of homeostasis in the body by generating heat. This heat is very noticeable during exercise, when sustained muscle movement causes body temperatures to rise, and in cases of extreme cold, when shivering produces random skeletal muscle contractions to generate heat. Smooth muscle. Smooth muscle, named because the cells do not have striations, are present in the walls of hollow organs like the urinary bladder, uterus, stomach, intestines, and in the walls of passageways, such as the arteries and veins of the circulatory system, and the tracts of the respiratory, urinary, and reproductive systems. Smooth muscle is also present in the eyes, where it functions to change the size of the iris and alter the shape of the lens, and in the skin, where it causes hair to stand erect in response to cold temperature or fear. Cardiac muscle. Cardiac muscle tissue is only found in the heart. Highly coordinated contractions of cardiac muscle pump blood into the vessels of the circulatory system. Similar to skeletal muscle, cardiac muscle is striated and organized into sarcomeres. Sarcomeres possessing the same banding organization as skeletal muscle. Cardiac muscle fibers also are extensively branched and are connected to one another at their ends by intercalated discs. An intercalated disc allows the cardiac muscle cells to contract in a wave-like pattern so that the heart can work as a pump. The physiology or function of the muscular system. The main function of the muscular system is to assist with movement. Muscles work as antagonistic pairs. As one muscle contracts, the other muscle relaxes. This contraction pulls on the bones and assists with movement. Contraction is the shortening of the muscle fibers, while relaxation lengthens the fibers. This sequence of relaxation and contraction is influenced by the nervous system. Muscles also work to keep the posture of the body. This is done through muscle contraction, where the trunk is kept straight either when sitting or standing. Naming of muscles. There are many nomenclature for naming muscles. Some of these include divisions, such as biceps, triceps, quadriceps, size, maximus meaning largest, minimus meaning smallest, shape, deltoid being triangular, and trapezius being trapezoid, and action, flexor to flex, and adductor towards the midline of the body. Common diseases and disorders of the muscular system. Duchenne muscular dystrophy, or DMD, is caused by the inability of the body to make dystrophin, a muscle protein. This causes the muscles to become weak as the person ages. This disease primarily affects boys, and signs and symptoms typically present before the age of 5. Signs and symptoms may include frequent falls and trouble keeping up with peers. Since all muscles are affected, the person will eventually require a wheelchair and assistance with breathing. Cerebral palsy. Cerebral palsy is caused by an interruption to the normal development of a person's brain, leading to weakness with muscles. Depending on the area of the brain that is affected, signs and symptoms will vary in the type and severity between individuals. Balance and coordination are often challenging due to the inability to control muscles. Carpal tunnel syndrome. Carpal tunnel syndrome may present with pain, numbness, or weakness to the hands caused by pressure on the median nerve. Some causes for this pressure are work-related, such as keyboarding with improper body mechanics, illness such as arthritis, and even pregnancy. Paralysis. Paralysis is the loss of strength and control of the muscles in parts of the body. Paralysis can be localized where it affects specific areas such as the face, feet, vocal cords, or it can be generalized where it affects a larger area of the body. There are various types of generalized paralysis, including paresis, a partial paralysis wherein there is still some control of the muscles. Paraplegia, which is paralysis that affects both legs and lower part of the body. Quadriplegia affects both arms, both legs, and sometimes from the neck down. And hemiplegia affects one side of the body, for example, the arm and leg on the same side of the body.